All right, in this lecture, we're going to just talk about kind of the basics of Estim for pain control. And so in particular, I'm going to describe ways in which Estim is used to modulate pain and just talk about the general parameters and the settings and the types of currents that we're going to be dealing with Estim for pain control. In a separate lecture, we'll talk about how we think that this really works. We'll touch on a little bit as we go along in this lecture. All right, so we have three basic treatment methods when using Estim for pain control. The first is subsensory, second is sensory, and the third is motor level stim. The first being subsensory stimulation, you'll see that on your machines called microcurrent. And so if we look at our diagram of sensory, motor, and then the N, we'll call that noxious level. We're going to talk about that here in just a little bit. But where we're talking about is the area before you hit the sensory nerve right here. Okay, so anywhere along in here, in this area right here. So before we've really depolarized anything, that can be felt. Okay, so that's called microcurrent, subliminal stimulation, and the intensities are just well below the threshold for nerve depolarization. The bottom line in the red letters at the bottom of the slide here, known efficacy. Study after study has failed to show any effect greater than placebo, but you will run into people that use it and use it consistently and claim that there's an effect, but no one's been able to show that in any kind of controlled study. Okay, so most common then would be sensory level TENS, and this is what you would call conventional or high rate TENS. And we talked the other day just about the word TENS, and that it's a bad term because we typically, I mean, it's the generally accepted term for pain, Estim for pain relief, but it just means transcutaneous electrical nerve stimulation, and that's what we do with everything, whether we're stimulating muscle or contracting muscle, we're stimulating the nerve, we're going through the skin, so that's also transcutaneous, right? So that's why the terminology is bad. Not going to go away anytime soon, so we just have to deal with it. So, you know, typically when someone says set up a TENS treatment, this is the one that they're going to be talking about right here. All right, so also known as conventional high rate TENS, and the parameters of that are usually in the 50 to 100 hertz, usually more towards the high end. You'll see the machines coming to life more along that line of the 100 hertz or pulses per second, but with a very low duration. So again, looking at our pulse duration curve right here, we're going to be out in this area or down in this area in this 20 to 100 range right here. And so we're going to use that so we preferentially just get our sensory nerve fibers stimulated. Kind of the short version then of how this is supposed to work is, as it says here on the slide, a direct block of transmission. So basically, you know, putting the nerve on a busy signal. We're putting some stimulus into those large diameter nerve fibers, and we're kind of tying up the transmission of those the painful responses that are traveling up those same nerve pathways. And so since we're just putting this on a busy signal, once we take it off, we don't have any more pain relief. So it has a quick onset. That's what we hope, is that it's, you know, when we put it on, we basically put it on busy signal there. And but the problem is as soon as you turn it off, typically the pain relief is going to end. All right, so you know, the indications for it then are when we want to have pain relief, when we have stimulation. So good ways to use any kind of pain relief stimulation is maybe during your exercise. You know, so you've got someone that comes in is having trouble doing their low back exercises, so maybe you do this treatment while they're exercising, so so they're able to go through normal ranges of motion and exercise while you're working with them. Okay, so the general parameters as listed there, usually at that high rate, like I said, usually towards the higher end of that, in the 100 hertz or so pulses per second for the frequency. Low duration in that 2 to 50, and that's probably usually closer to that 50, maybe 40 to 50 microseconds. And then a lower intensity, and we're just going to set this based on the patient tolerance, and you're just going to take it up to where you get a tolerated tingling. So you turn it up, do you feel that, and then take it up to where they have a very more or less pleasant tingling sensation. All right, so that's setting up high rate or conventional TENS. Okay, so just a little more, another slide just here on the parameters, and the current type for that is, it's typically an asymmetric biphasic current is what you see. So one of the machines there, one of our Chattanooga machines, has that built into it, and so you can play around with that, and hopefully we'll get some TENS devices that you can utilize as well. But typically any asymmetric biphasic, but really any kind of current that we can control the parameters and get the frequency set correctly, get the pulse duration down real low, and just set up for that tingling sensation is going to be used for sensory level TENS. And this really applies to our interferential current as well. So like I said, the amplitude is just a nice tolerated tingling sensation. We're not using any ramps. You just turn this on, and basically you're ramping it as you turn it on, because you're turning the intensity up, and you're saying, do you feel this, do you feel this, do you feel this? So that's in essence ramping it as you go. And then for electrode placement, this is just all over the map. Okay, so typical recommendations are to start with, around the painful area, bracketing the area, but you can also use different related areas, such as trigger points. So you can get out a trigger point map and use this just as if you were doing a dry needling or pressure point therapy or anything like that, that you can put this right over different trigger points, acupressure points, related dermatomes. So I've seen some just dramatic effects with placing over the appropriate dermatome and being able to shut off tingling, let's say in the arm or hand. My father a number of years ago was in a bad auto accident and was having just terrible pain down his arm, have some radicular pain. And the therapist at the time that he was seeing out where I grew up out in New Mexico used a TENS unit, and he put this over the dermatome. He was having pain over C8, and he put the pads basically around C8, T1, and he was able to completely shut off the pain that he was having going down his arm. So a very dramatic effect. I mean, as soon as he took it off, he was in a lot of pain again, but it worked wonderfully. So a lot of good examples of that, of being able to use, not just at the area. So a lot of this is you're gonna play around with these pad placements, and the first time might not work. You may try it in one spot and then try it in another spot. And the patient, a lot of times we're checking these units out, or they're buying the units and they're taking them home. But a lot of times the patients will find the right area to put them. And I always encourage people to experiment, play around with the places that they're putting the pads, because they're living with it 24/7. They're gonna find the right combination of areas. So give them the instruction and then let them try it. So last one then, well, not actually the last one, but the next one, motor level TENS. And so here is where we take and turn that up until the point that we get a motor nerve stimulated. So again, we're right back to where we were for our muscle contraction. So as you can imagine, that we're gonna pick an appropriate duration to stimulate the muscle for this. And so this is called low rate TENS, or acupuncture-like TENS. And this can be extremely effective. Don't see it used very much, and that's unfortunate, because if we were going to be putting on TENS on someone, this works really, really well. And one of the reasons for that is that it does kick in our endorphins, so it's opiate mediated, and by setting up the stimulation this way, we can get a long-lasting response. And usually you don't get the pain relief right there during the treatment. You'll get it 20 to 30, 40 minutes after the treatment, but it can last for hours because you are kicking in the endorphin system. So a real nice one to learn how to use. Okay, so as you can imagine, if we're going to set up for a muscle contraction, we're going to want to be in that 100 to 600 pulse duration range again. And we're going to set this up till we get a very firm contraction, or as I put here, max tolerated contraction. We're not putting any ramp on this. And then we're going to have a time is we're going to set this thing it's going to run for 15 to 60 minutes, and we're going to set this thing up somewhere, and I have here less than 20 pulses per second. Most of the time you're going to see this a lot less. You're going to see it more in the 10 per second range for frequency. So you're going to get a very firm contraction that's going to be contracting the muscle strongly, but in a rate somewhere less than 20 times per second. So it's going to be a pretty quick popping of that muscle as it goes. So as you can imagine, it's going to be boom, 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 boom. Okay, and just contracting the muscle. Okay, so treatment time can be anywhere from 50 to 60 minutes. And you're going to take the electrodes, and that's going to be over the over area that is related to that painful area. So noxious level stimulation then. This one is we're going to take that pulse duration out until we hit that noxious level or painful level of stim right here. All right, so this one, just about guaranteed, no one's seen this one done. But again, unfortunate because this one tends to work fairly well too. So again, the mechanism of this one is the opiate mediated, and very useful people with chronic conditions, chronic Achilles tendonitis or elbow tendonitis, things that have been existing for some time and nothing else has kind of worked. And so dancers, violin players, people who tend to be overusers and having problems and having to continue with whatever their activity is in order to make their living. And so treatment time is usually is fairly short, and as we put here, seconds to minutes, but usually it's only a few seconds long. And again, we get some long-lasting pain relief from that. All right, so again, we can any type of current can be used for this. A lot of the machines are set up, in particular to use a particular type, but anything where we can get that pulse duration up pretty high, and we're going to take it to an amplitude that we get that max tolerated tingling, almost like a bee sting sort of a feel. We're going to take the frequency and take it up way high, upwards of 200 pulses per second, so a bit higher than what we're used to running as well. And then treatment time, again, like I said, seconds to minutes. And the best way to use this is using some very small electrodes right over the painful area, trigger points or acupuncture points. And so you can either buy small electrodes, you can cut electrodes down that you already have, and we'll demonstrate this in lab, is that we've got some small probes, and those work really well for this. And so you take the very small probe, it's about the size of a ballpoint pen, maybe just a little bit larger than that, and use that. So that's when we're talking about a small electrode, we're going to use that. In years past, there was a machine called a neuroprobe, and you might run into one of those. We've got one in the lab. We'll pull out and use that, and it does the same thing as well. And basically, when we're using that small tip, all we're using is a super small pad. Okay, so just keep that in mind. We're putting a lot of charge through a very small. And precautions or contraindications, really the same for any other Estim device, as we discussed. For pacemakers, often it's suggested that an ECG is done during a TENS trial to make sure there are no adverse effects. So one of the things to look at is just who's doing the referral for the TENS unit when you've got a patient that does have a pacemaker. Typically these days pacemakers aren't affected by TENS units, but always a good question to ask. And so good to call the physician or ask the patient, was this is this being recommended by your cardiologist, and has he seen his cardiologist recently? Does he know he's getting a TENS unit? And so do some trial and checking like that prior to giving just handing one to someone who does have a pacemaker. Okay, the FDA suggests that Estim shouldn't be used over the abdomen of pregnant women. But you'll see a lot of recommendations for people using TENS units during labor and with no complications noted. All right, so and again, the most common complication with these kind of units, skin irritation due to electrodes. All right, so you just have to watch, and current intensities, they can cause burns, but as well just someone having a reaction to the stickiness in the pads too. So some people can have problems with the pads. All right, so that basically covers the major types of stim that we're going to be using for pain relief. We didn't talk in particular about interferential, and so we'll talk about that in another lecture as well. But interferential would be the other current that we're going to be using for pain relief. And after you look at these parameters, and then we start to talk about interferential, you kind of get the idea of why interferential works, very, very similarly. And we'll look at that in lab this week. All right, I'll see you guys in lab. Bye.